Hi, my name's Karen Pazel. I'm a health scientist at the Centers for Disease Control and Prevention, or CDC. I'm the lead author on the paper Health and Education Services during the COVID-19 pandemic among young children with autism spectrum disorder and other developmental disabilities. I'm excited to share with you today the findings from this paper. They're based on a survey funded by CDC asking caregivers of young children ages 3 to 8 years about their experiences with health and education services during the COVID-19 pandemic. This survey was unique because the caregivers and their children had previously participated in CDC's Study to Explore Early Development, or SEED, which is a case control study of young children with autism. Thus, with data collected before the pandemic, we were able to establish 3 groups of children: those with autism, those with other developmental disabilities, and a population comparison group. Caregivers in each group were asked about their child's experiences in 2020 during the onset of the COVID-19 pandemic. So here are a few key findings from this survey, along with their implications for providing services during future public health emergencies. Across the 3 study groups for regular health and dental services, more than half of all caregivers reported that their child missed appointments or had their appointments delayed. However, for specialty services, such as behavior therapy, the percentage of missed or delayed appointments ranged widely from 23% in the population comparison group to 76% in the autism group. When caregivers were asked why they had difficulty accessing services for their child, the most common responses across all 3 study groups were avoiding COVID-19 transmission and clinic closures. However, caregivers in the autism group were much more likely than caregivers in the other groups to report their child had difficulties using telehealth and wearing a mask. Challenges accessing remote services may also have impacted the receipt of school support services, such as individualized education plans or IEPs. These supports are commonly used among children with autism, and for some may be the only source of developmental and behavioral services. In our survey, across all 3 groups, we found live online classes were the most common resource schools offered during closures. Yet, attending online classes might have been challenging for children with autism. Indeed, our study found that half of children with autism, as compared to 36% of children with other developmental disabilities, had disruptions to their special education services. These findings have important implications for providing services during future public health emergencies. Our finding that caregivers across all 3 study groups reported disruptions highlights the need to keep services ongoing for all children. Also, the disruptions that occurred for so many children during the COVID-19 pandemic suggest the need to explore whether certain children need additional services now to compensate for the care they may have missed. Finally, our finding that children with autism experienced more extreme disruptions highlights the importance of meeting their special service needs in future public health emergencies. Moving forward, CDC will continue to conduct research on the service needs of individuals with autism from early childhood throughout their lifespan. This research will help us better understand how we can help people with autism and their families live their lives to the fullest. For more information about CDC's activities related to autism, please visit cdc.gov/autism.